Hello. Hi, my name is Ross Mandigo and I'm a student PTA. Is it okay if I work with you today?
Yep.
All right. Can I get your name and your date of birth?
Is that correct? 1504.
Okay. And what day of the week is it?
It's Thursday,
And what year is it?
2025.
That is correct. So I hear on your chart, well, I don't hear, I see on your chart that you had a stroke 8 months ago and you're having trouble putting on your pants. Is that true?
Yes.
Okay. So before we get started and I explain what your treatment contains today, I would like to ask you about your pain. From a scale of 0 being no pain and 10 being the worst pain you ever had in your life, what is your pain?
It's like a 2
And where is this pain?
on the left side of my leg.
Okay, all right. I'll think for that in a minute. What's your activities day to day?
Well, dressing myself and getting up and trying to eat, stuff like that.
Do you work?
I did.
Do you plan on going back?
I do.
What do you do?
I'm a sales rep at Costco.
Oh, that's fun. That's fun. And then what was your prior level of function before your stroke?
I was independent.
Okay, okay. And then as far as physical therapy, what goals do you have to get out of treatments?
Become as functional as possible.
That's pretty solid. Okay, okay. So today what we're going to be working on is PNF. PNF and NDTs is functional, well, PNF is a functional diagonal pattern, which should help you with your ADLs day to day, and NDTs help you with sit-to stands and walking and bed mobility. Today we're going to be working on a D1 PNF, which I will be explaining to you later. Throughout the treatment, you may expect to be uncomfortable, fatigued, and frustrated. There are going to be times that you're going to be might lose balance, but that's okay because I'm going to be applying this gait belt before we get started. A second person will be with me. Her name is Patricia Starr. She's going to be assisting me throughout the treatments today. And then during treatment, you should not feel any pain. If you do feel pain, stop and let me know. And that goes for at home when you're doing your home exercise programs, which I will be explaining to you later. You shouldn't feel any pain if you do stop, okay?
Okay.
All right, so before I get anything started, I'm gonna be applying this gait belt. Alrighty. All right, can you arch your back for me? Yeah. This shouldn't be too tight. Is this fine?
Yeah, it's good.
Okay. Alrighty. So before I do anything, I just gotta check your skin. Taking off your shoe. Do you mind if I take off your sock?
No.
Okay. I'm just gonna check your left leg. The skin is intact. Thank you, sir.
Mm-hmm.
I will put your sock back on. Okay. Yeah, okay, there we go. So, what I'm gonna ask you to do is if you can flip towards me, we're gonna turn on your stomach, okay? So I'm just gonna grab this, and I kinda want you to roll onto this side, okay?
Okay.
All right, so 1, 2, 3. Yep. Yep. All right. So I'm just gonna come over here. And what I'm going to be measuring is just hip extension. I'm just gonna palpate here. Can you turn your foot leg in and out? So, yeah, okay. So then what I want you to do before I start measuring is just bring your foot and keep your leg straight to the ceiling as high as you can. All right, any pain with that?
No.
Okay, and then can you do that motion again?
Yep.
All right, I'm getting 35. normal is 20. So that's really good. All right. So our next thing that we are going to do is I'm going to ask you to roll towards me again. Okay, so on the count of 3, you're gonna roll towards me. 1, 2, 3. Yep. Okay, how do you feel? Good. Okay, so then our first thing that we're gonna be working on is PNF. And then this PNF is going to help you. It's specifically good for like putting on pants. So then what I want you to do is start with your leg out like this. Your left, yep. Maybe I should start over here so you can see. You're gonna start like this, and then what you're gonna do is that you're going to bring that leg in. Just like that. Any pain with that?
No.
Okay. So then what we're gonna do, you can bring your leg slightly off, and then I'm gonna have to raise the table. Sorry, body mechanic. Very nice. Okay. So then what we're gonna do is this, I'm just gonna facilitate you doing, and we're just gonna do a few practice runs, and then we'll take it from there, okay? All right, so then what I want you to do is point your toe up and in, and then you're gonna push against my hand, okay? Now point your toes down and out. Okay, point your toe up and in. Point your toe down and out. All right, one more time, point your toe up and in. All right, and now point your toe down and out. Okay, so then the next step is that now we're gonna keep doing that, but I'm gonna do a little quick stretch to help you get that movement, okay?
Okay.
All right, so then I'm gonna start here, so bam, now point your toe up and in. Bam, and then push against me. Yep, and then we're gonna do 1 set of 10. Okay, so then go, we already did the quick stretch. Yep, put your toe down and out. Go up and in, down and out, up and in, down and out, up and in, down and out, up and in, down and out. All right, that was 1 set of 10. So what we're going to do is I'm going to help you, because see, it says in your chart that you have trouble completing movements. So I'm just going to give you a quick little shake at the end of the movements that we did, okay? And we're gonna do 3 sets of 10, okay?
Okay.
All right, so then I want you to start out. I'm gonna do my quick stretch, flex. All right, now point your toe up and in. And then 1, 2, 3, okay. I'm gonna quick stretch up here, and then push against me. And then 1, 2, 3. All right, now point your toe up and in. Yep. 1, 2, 3. Now point your toe down and out. 1, 2, 3. Up and in. 1, 2, 3. Down and out. 1, 2, 3. Up and in. 1, 2, 3. Down and out. 1, 2, 3. One more time. Up and in. 1, 2, 3. And then down and out. 1, 2, 3. That was our first set of 10, and we're doing 3 sets of 10. 3 sets of 10 have been. I just want to state that this is going to be your home exercise program without the, I'm going to be training a person, a second person needs to be with you to do the shaking, and I'm going to be training them on how to do that, but you're going to be doing that once a day, 3 sets of 10 every day, okay?
Okay.
And that should help you be more functional on like putting on your pants, okay? And remember, if you have any pain at home, stop and then let me know. Okay, so now we're gonna be doing our NDTs, which is a sit to stand. But before I get started, I'm going to place your shoe back on. I hope that this is better than my sock placing. All right, I'm just gonna lower the table. So then, what this composes of is that I'm going to be facilitating you standing and sitting, okay? And we're gonna do it twice. So what I'm gonna be doing is that I'm gonna be kind of like grabbing your belt, and I'm gonna be holding your foot to help you know where you're putting your weight, okay? All right, so the first thing that we're gonna do is that we're gonna straighten out your legs, okay? And then I'm going to push you towards me and then forward, and then I want you to stand up when I start going up, okay? On the count of 3. 1, 2, 3. All right, how do you feel?
Good.
All right, and then I want you to take your good arm and place it on the table, and then I want you to sit down. Okay, how did that feel?
Fine.
We're gonna do it one more time. So I want you to lean forward and then put weight on this foot. Yep, stand up. And then I want you to place that hand down again. And then we're gonna sit down. Any pain with that?
No.
Excellent, all right. So then you can lie down on the table again for me. Very nice. Okay. And then your home exercise program for that, again, you're gonna need 2 people. And thank you, Patricia Starr, for assisting me with the NDT. You're gonna have 2 people, your caregivers at home, they're gonna be working on that too, and I'm training them on doing that as well. And you're gonna be doing that every time you do a sit to stand. So anytime you're in a chair, I want 2 people to be assisting you in like getting up, okay? Again, if you feel any pain at home, stop, okay? All right, so then now I just gotta do your post-skin assessment. I'm gonna take your shoe and sock off again, okay? All right. The skin is intact. Just gonna let that back on. Very nice. I can't do it. All right, but your skin is intact. You want to put your shoe back on? If you're okay. And then you said your pain was in your like lower leg.
Yep.
Is it still like in this area?
No.
Okay.
It's gone.
It's gone.
Nope.
0 out of 10.
0 out of 10.
Very nice. And then and then can you? I'm gonna ask you to flip again. I need to just see you do that hip extension one more time. All right. And then can you just raise this leg again for me? Any pain with that?
No.
That looks pretty solid. Did you have any other questions for me?
No.
All right, I'm gonna flip you back on your side, on your back. Very nice. Okay. And then, no questions? You know your home exercise program?
Oh, yeah.
Repeat it to me.
Okay, PNF pattern, we need 2 people. Someone to do the shakes at the top of the motion, and I have to do the sit to stands with 2 people to make sure that I'm off balance, and you're gonna give them directions and education so that I can properly do the motion.
That's correct, thank you.
And no pain.
Are you satisfied with your service today, sir?
I'm satisfied.
Thank you. Thank you for working with me.
Of course.
Goodbye.